Welcome to the Asian and Pacific Islander American Health Forum Policy Division Update. From Washington, D.C., this is Lloyd, Asato. The U.S. House of Representatives Committee on Education and Labor began hearings this month on how to improve responses for and prevent violence and abuse in families in crisis. FIPSA, the Family Violence Prevention Services Act, expires this year. A bill to reauthorize FIPSA is expected to be submitted soon. FIPSA was enacted by Congress in 1984 to address public awareness and prevention of family violence and provide services for victims and their dependents. FIPSA supports services provided by more than 2,000 community-based domestic violence programs nationwide. These shelters and local programs provide residential and non-residential services such as shelter and transitional housing, safety planning, counseling, legal services, child care and services for children, amongst others. Congress must pass legislation to reauthorize FIPSA this year in order to ensure that communities can continue to support victims and families escaping abuse. President Obama signed the Ryan White HIV/AIDS Treatment Extension Act of 2009. This act addresses treatment gaps in Medicare, Medicaid, private insurance, and other publicly funded healthcare systems by providing services to uninsured and underinsured HIV-positive individuals. This act helps over 500,000 lower-income Americans each year and extends funding for an additional 4 years and allocates $2.55 billion for 2010. The act would have expired this year if not extended. It is important to note that it passed with overwhelming bipartisan support, 408-4, with only 9 voting against. The act supports education and prevention efforts and strengthens data reporting. President Obama also announced the elimination of the HIV Entry Ban. This rule change completes the effort began in 2008 when President Bush signed a bill that included lifting the entry ban. That was the PEPFAR, the U.S. President's Emergency Plan for AIDS Relief. As you know, since 1987, individuals with HIV were banned from traveling or emigrating to the United States. This ban was established in the 80s by the U.S. Public Health Service, and in 1987, the Senate, led by Senator Jesse Helms of North Carolina, added HIV to the travel exclusion list by adding HIV infection to the definition of communicable disease of public health significance. While HIV is a serious health condition, it is not a communicable disease that rises to the level of public health significance, and in 2008, as part of the President Bush's AIDS plan, PEPFAR signed H.R. 5501, which was the Tom Lantos and Henry J. Hyde United States Global Leadership Against AIDS, Tuberculosis, and Malaria Reauthorization Act of 2008. That bill included a provision lifting the entry ban. This was followed by the rule change at Health and Human Services, eliminating the entry ban that President Obama announced. The Centers for Disease Control and Prevention announced that HPV vaccinations will no longer be required as part of the immigration process. Since August of 2008, young girls and women aged 11 to 26 were required to be vaccinated against the human papillomavirus prior to immigrating to the United States. This change created a burden for immigrants by increasing already high costs and did little to prevent the spread of HPV. This month, the CDC stated that it is removing HPV from the required vaccination list because it does not meet the adopted criteria. The CDC stated that, quote, HPV neither causes outbreaks nor is it associated with outbreaks, and that HPV has not been eliminated nor is in the process of elimination in the United States, end quote. These were the criteria that was used to put HPV vaccinations on the required list. The rule change is effective in December of 2009. The big news is the U.S. House of Representatives passed H.R. 3962, the Affordable Health Care for America Act, by a vote of 220 to 215. This vote allows healthcare reform efforts to continue by moving the bill out of the House. We now await the Senate's action on healthcare reform legislation. The bill in the House creates a health insurance exchange where consumers can shop from a menu of affordable health care options that include private plans, health co-ops, and a new public health insurance option. This new public health insurance option will be created to compete with private insurers. The bill also provides subsidies to families who are purchasing health insurance. It extends Medicaid eligibility to poor and low-income adults and children, including pregnant women and adults without dependent children, and offers Medicaid to all newborns. Importantly for our community, it extends Medicaid coverage to citizens of the Federated States of Micronesia, the Republic of the Marshall Islands, and the Republic of Palau who reside here in the United States, and provides an exception to the 5-year waiting period. It includes provisions that address racial and ethnic disparities in health outcomes, and it provides an increase in payment for language services and includes a study on the feasibility of developing Medicare payment systems for language services. It also provides demonstration grants to explore how Medicare can pay for culturally and linguistically appropriate services, and it requires uniform standards for the collection of data on race, ethnicity, and primary language. It also bars many common practices within the insurance agency, such as the use of gender and health status as premium rating factors, and it provides a long-standing health insurance antitrust exemption from it removes this antitrust exemption from the laws covering market allocation, price fixing, and bid rigging. This has been the Asian and Pacific Islander American Health Forum Policy Update. From Washington, D.C., this is Lloyd Asato. Thank you very much for watching.